Hi, and welcome back to another episode of the Precision Health Podcast. So, in this episode today, I want to talk about blood sugar. And I know that's maybe a topic that a lot of you don't really want to hear about because you love your mid afternoon chocolate bar or your porridge in the morning, or you do love your gin and tonic, things like that. Now, I'm going to have to spoil that a little bit for you. Spoiler alert, blood sugar swings are not a great thing. But everything in moderation, and I'll get to that at the end of the episode to talk about how you can actually include some healthy sugars, small amounts of sugars without running into trouble. But first of all, we'll start off with why blood sugar spikes are not a good thing. And you might have heard about insulin resistance and metabolic syndrome. I've talked a lot about it in my other social channels on how when you have repetitive and long-term blood sugar swings, eventually our cells stop responding to insulin, and then we have a lot of problems down the line, such as a layer of belly fat, that apple shape, that visceral fat that is inflammatory and is linked to cardiovascular disease, Alzheimer's risk, things like that. But that's a long-term effect. Today, I want to talk about the short-term effect of blood sugar spikes. Every time you have a blood sugar spike, what happens inside your body, and in particular also if that happens repeatedly. So number one is research shows that if you have hypoglycemia, which is a blood sugar spike, then you're actually more prone to inflammation. Your body will trigger certain cells inside your immune system that are more inflammatory. Now, every time you have a blood sugar spike, that happens. If those blood sugar spikes happen repeatedly, then you're more prone to chronic low-grade inflammation. And research also shows that that increases the risk of neurodegeneration, including Alzheimer's. So what they show is that there's a higher risk of neuroinflammation, including your brain cells, such as the astrocytes, and glial cells, so things inside the brain that we really want to function well so that we can age well and our brain function stays up. Research shows that blood sugar spikes damage that and make them work less well. Like I said before, having repeated blood sugar spikes, and in particular also insulin resistance, which is the long-term effect of it, has a higher risk of Alzheimer's disease. Now, research even goes that far to say that Alzheimer's can be termed, quote unquote, type 3 diabetes because so much of its underlying biology is similar. So having repeated blood sugar spikes and insulin resistance obviously is a risk factor for type 2 diabetes, but it also is a really very prevalent risk factor, an important risk factor for Alzheimer's disease. Now, research also shows that when a mother has a high fructose diet, meaning that there's a lot of fruit sugar, in particular the processed version, such as in high fructose corn syrup, that actually has not just a bad effect on the mother, but also a bad effect on the offspring, on the babies. Now, research shows that if the mother consumes a ton of processed fructose, a really high fructose diet, then the babies are at a higher risk of having chronic low-grade inflammation throughout life. For example, they have a messed up immune system all the way into adolescence, and also a higher risk of inflammation-triggered anxiety. Now, all of these are not great effects. Another thing that if you're eating, you love your little afternoon pick-me-up, a sugary a chocolate bar here and there. Another reason why that might not be the best option on a regular basis is that repeated blood sugar spikes have also been shown to increase cardiovascular disease risk. Now, in particular, they've been shown to increase blood pressure in susceptible individuals. Now, how that happens is that repeated blood sugar spikes damage our cardiovascular, the lining of our cardiovascular system, our blood vessels. Is also called endothelial lining. Now, if that gets damaged, our blood vessels are less pliable, less flexible, and they become stiffer, meaning that our blood pressure stays elevated because it can't really do its It can't really go down when it needs to. It can't relax when it needs to because the blood vessels are stiffer. So there's a high correlation between high blood sugar spikes, repeated blood sugar spikes, and hypertension, blood pressure issues. Now, in addition to that, it's also being linked to increasing salt sensitivity. Now, we know that if people, especially people with a genetic predisposition towards it, if we're overeating salt, not normal amounts of salt, because that's most likely very healthy actually, but if we're over consuming especially processed salt, then in some people that might increase our blood pressure. Now, research shows that if we are having blood sugar spikes, that makes us more salt sensitive and more likely to have a bad effect towards the intake of salt on our blood pressure. So not a good effect to have. Another thing that you might have noticed is that you might be catching any cold that comes your way, and one of the reasons can be repeated blood sugar spikes. Now, research shows that having blood sugar spikes messes with our immune system. I talked before about how it increases inflammation, which is part of our immune system, but it actually also renders our immune system less efficient. What that means is that if we are being attacked by an invader, such as a bacteria or a virus, then our immune system isn't as able and as good at getting rid of it. And in the long term, the even worse effect is that it kind of lowers something called immune surveillance, which is where tumor cells might be able to evade our immune system. Now, we all have mini mutations all the time, but our immune system usually can take care of them. If the immune system can't take care of them and they evade our immune system, then we're at a higher risk of cancers. Research shows that repeated blood sugar spikes and a diet high in sugars, especially processed sugars, has a higher risk of cancer, in particular also worse outcomes. So for example, they did research on colon cancer and they found that people, I think it was a mice study actually, mice on a high sugar diet their cancers were growing much quicker than in other people. So that also partly is due to the immune system that just can't do its thing. There are other factors, but I won't get into detail here today. Now, on the contrary, a high sugar diet and repeated blood sugar spikes also mess with our immune system in the way that it makes it overreactive towards an autoimmune predisposition. Now, we want our immune system to work well to get rid of invaders and tumor cells, but we want to make sure that it doesn't get overreactive and start to attack our cells, which is what an autoimmune disease is. Now, research shows that people on a high sugar diet, especially with a lot of blood sugar spikes, they are more likely to shift their immune system towards something called the Th17 response, which is more of a autoimmune predisposition, autoimmune type of response. Now, common autoimmune diseases are things like ulcerative colitis, Crohn's disease, Hashimoto's, multiple sclerosis, psoriasis. There are lots of rheumatoid arthritis, lots of autoimmune diseases, and they're becoming quite prevalent, sadly, because they can be quite debilitating. And blood sugar spikes might be one of the factors that are contributing to the development and to the worsening of the outcome. Another way that happens is that high sugar diet has been shown to increase the amount of something called Prevotella. It's a type of bacteria in our gut, which has been linked to autoimmune flares and triggering autoimmune disease in the first place. Now, none of this is just one cause and effect, but they're all contributing factors. Another effect on our gut health is that a high sugar diet has been linked to not only a higher risk of bad bacteria that can trigger things like autoimmunity, but also lower levels of good bacteria such as lactobacillus. Now, if we don't have enough of the good type of bacteria and we have too many of the bad type of bacteria, what happens is that our immune or our gut lining becomes more permeable and less resistant and resilient to invaders, but also it allows certain food particles to pass into the bloodstream that usually shouldn't be there, and all of a sudden the body starts to develop food intolerances and allergies to otherwise healthy food, and then we become more inflamed and have issues systemically. Now, blood sugar spikes have been in a high sugar diet has been shown to increase the risk of bad bacteria and lower good bacteria. That can also contribute to digestive issues because it can increase the risk of SIBO, small intestinal bacterial overgrowth. It can increase the risk of something called Candida albicans, a type of fungus that can overgrow inside us. And they all like the sugars. And if we're having tons of it, then we might be more prone towards those. Okay, another thing that you might find interesting, I found it quite interesting, is that blood sugar spikes and a high sugar diet can make us age from the inside out. Now, how does it do that? Number one is that it increases something called advanced glycation end products, also short ages. So it makes us age from the inside. It's when sugar attaches itself to our protein and our fats, and that's what our body is made out of. And if we're constantly having blood sugar spikes, we have all these ages inside our body, these advanced glycation end products. And they actually can mess with our collagen structure, with our connective tissue. So that leads to wrinkles and joint aches and problems with our connective tissue pliability, our blood vessels. But it also increases our risk of free radical damage, inflammation, and other factors like that. Now, another thing, why we age faster if we have a high sugar diet is that it increases free radicals. And research shows that it upregulates our oxidative stress genes, the ones that are responsible for free radical damage, and downregulates at the same time our antioxidant genes. So we actually have antioxidants inside our body that help to fight off inflammation, fight off free radical damage. But a high sugar diet and blood sugar swings have been shown to downregulate our own defense mechanisms. So that is kind of a double whammy. Along the same lines, if you are trying to heal from something, you've had a surgery or you've had an injury, then research shows that a high sugar diet and blood sugar swings actually downregulate our healing capacity and our repair. So it might make sense, especially let's say you're in hospital and you're trying to heal from something, then you don't want to have a high sugar diet there. You want to really try and balance things out, get all the right nutrients. But we'll talk about what you can do and how you can balance these things at the end of this episode. Now, in the beginning, I spoke about the bad effect of high sugar diet or blood sugar swings on our blood vessels and hypertension, blood pressure, but it actually also has other detrimental side effects on our cardiovascular system and health. Now, research shows that having a high sugar diet and lots of blood sugar spikes increases our bad type of cholesterol called LDL cholesterol. And in particular, if we're eating tons of sugars at expense of good type of fats such as omega-3s, then we actually often have a lower level of the good type, the protective cholesterol called HDL cholesterol. In addition to that, research shows that it doesn't just increase our LDL cholesterol, the bad one, but it also changes the size of it and makes them smaller and basically more damaging when they're in our blood vessels, and they can damage the lining more. It also has been shown to increase our triglycerides. So all in all, it might not be that it's our fat intake, but it might after all be our sugar intake and blood sugar spikes that are contributing to our cholesterol and heart disease problems. Now, lastly, if this continues for a long time, and that's where I started off, is that if we have these constant blood sugar spikes for a long time, every time we have blood sugar, an elevation of blood sugar, our body produces insulin to take that blood sugar and put it inside the cell, either for energy use or storage. Now, if that happens all the time, eventually the cells might stop responding to the signaling of insulin. And then A, it keeps our blood sugar elevated, but B, it makes our cells called insulin resistant. They're not responding to it well anymore. And that then contributes to things like metabolic syndrome, which I have done other blog posts about and a lot on my social channels. I might do an episode on that if I have time at some point, but it is highly linked to that apple-shaped body, that muffin top, that excess layer of belly fat, which has been linked to inflammation, Alzheimer's, cardiovascular disease, cancer risks, all these types of things that basically, if you're having blood sugar spikes short term, they already kind of contribute to that. But if you're all the way down towards insulin resistant, then it's really a bigger problem. Research shows that it is not just about, it's not just blood sugar spikes that are bad, but also drops that are bad. So you don't want to just cut out sugars entirely. Now, low sugar, hypoglycemia, has been linked to increased risk of cardiovascular disease in itself. Most likely, that's because when you have a blood sugar dip and you don't have enough blood sugar, then your body thinks it's in danger, and it starts to pump out a stress response. Our sympathetic nervous system, that fight or flight mode, gets activated. And what that does, it pumps out adrenaline and cortisol, and that then makes our liver make and create sugar so that our muscle cells have energy to run away from that perceived threat. And that response in itself increases our blood pressure and has lots of bad effects. So that's probably one of the reasons research thinks that blood sugar dips are also not good for our cardiovascular health. Now, the aim of this whole thing is that we want to balance our blood sugar. Research shows that it is not so much about what our average blood sugar is, but what our spikes are. Now, me including, we used to think that if we just look at our average blood sugar, called HbA1c, hemoglobin A1c, that's an average of the blood sugar over the last 3 to 4 months, that would give us a really good indication of what our blood sugar is doing. And if that's low, then that's not a problem. Now, sadly, that's maybe not quite the case. Obviously, if it's overall on the lower end, then you're less likely to have lots of blood sugar spikes. But what also happens is, let's say you have that average. If you have very little spikes, which is perfect, tiny little, your blood sugar is very balanced, then you have the same average as if you have a ton of big spikes and drops, because it averages out at the same amount. So I've created a blog post on this. If you want to look at the chart and the research behind it, then just click the link below and you can read through it all and have it look at it visually, because I think it's quite interesting. You might now think, okay, now I have to cut out all the fun in life. I can't have any sugars anymore. But actually, it's not quite like that. So there are some strategies you can do and implement to help your body have less blood sugar spikes and drops and have a more balanced blood sugar. Now, obviously, number one is to not have a high sugar diet. Stop having tons of, let's say, really fast sugars like chocolate bars and a gin and tonic. It's just sugar water. They will spike your blood sugar, and then what happens after? You'll have a drop. Now, research shows the best way on let's say 90% of the time, maybe 80% of the time, you want to have a shift towards like more of a Mediterranean whole foods diet. If you have more fiber in your diet, so having real food rather than the juice version or the processed version, if you have more fiber, the real food, the real vegetables, then your blood sugar is a lot more stable. Now, we don't want to cut out carbs and sugars entirely. And I've done another podcast on this, on the risks of going keto for too long. So keto got really trendy and it has lots of amazing health benefits. That's when you cut out sugars pretty much almost entirely. But it's only good to be doing it intermittently unless you have a certain health condition that needs you to do that more long term. But for most people, if you're just interested in health optimization, then you want to go into a more low carb range, and you want to try and have real foods. So a whole potato or a whole apple or full hand of berries. And if you're going for some more processed sugars just once in a while, try and balance it out with protein. Now, research shows that if you add protein to even something that is really high in sugar, it kind of dampens the blood sugar spike and drop a little bit. So even though you shouldn't have those junky sugars too much. If you have some protein with it, it will balance things out. In particular, if you're adding some fiber with it as well. So if you're having a real meal based on vegetables, some good protein, and research shows both plant-based protein but also animal-based protein is really good for balancing blood sugar. If you then have that chocolate or that chocolate bar as dessert, the effect will be very different to when you just have that chocolate bar in the middle of the afternoon or the middle of the morning on its own. A really good way to test that, and I actually try and encourage most of my patients now to have one of them at least once, is called a continuous blood glucose monitor. You can put it on your arm for 2 weeks. You can buy these monitors online, and it shows you what your blood sugar is doing in response to different foods, drinks, stress, sleep, everything. And oftentimes people are it's quite interesting. I find it interesting to see whether if I have a coffee with a certain type of fatty, protein-rich nut milk, it has a different effect than if I have black coffee alone. That's another thing. Research shows that having too much caffeine can actually increase blood sugar and also make it stay up higher for longer. So even though caffeine in small amounts is great, it has good effects unless you're genetically susceptible to not be able to metabolize it well. Having too much of it is not a good thing for your blood sugar either. Now, another thing that helps with blood sugar control is to fix your gut microbiome. Now, as I spoke about before, if we have high blood sugar spikes, it messes with our gut bacteria and our gut health, the good and bad type of bacteria, but it is also the other way around. Now, research shows that if we have more of the good type of bacteria in the gut, they produce something called GLP-1, which has become famous because Ozempic, that weight loss drug that a lot of celebrities use, actually has a similar effect or mimics the effect of the GLP-1 that gets produced by our gut if it's in a good, healthy state and it has the right kind of bacteria in there in response to a sugary to food. Now, what that does, if we have the right type of bacteria in the gut, a healthy gut microbiome, then we eat something with sugars, as long as it's not excessive amounts, then the body produces GLP-1, it makes our body produce insulin, then it utilizes the glucose and we don't have blood sugar or less of a blood sugar spike. We have less of a hunger craving, less of a blood sugar drop that makes us crave food after. All these effects of Ozempic. If we just fix our gut bacteria, we actually can naturally do that without the side effects of, or potential side effects of, a weight loss drug like Ozempic. Now, on the contrary, if we have an overgrowth of the bad type of bacteria, it actually makes our blood sugar balance a lot less stable, and it increases inflammation in the gut lining, and that then also makes our blood sugar control less. Now, a few more lifestyle factors that actually help with the blood sugar, they're unrelated to our diet, are stress, sleep, and exercise. I have a lot of patients that come in and they say, I'm trying to eat really well, I have a low sugar diet, but why is my blood sugar still elevated? Why do I have these blood sugar spikes? Now, I already hinted at it before when I talked about coffee and caffeine, but it's a similar thing with stress. Now, when we're stressed out, our body thinks we're running away from a perceived tiger, and it puts us into fight or flight mode. And when we are in fight or flight mode, our body signals to our liver to make sugar. It makes glucose itself, even if we're not consuming it, because it thinks it needs that as an energy provider for our muscle cells to run away from that perceived tiger. Now, if we're constantly stressed, we're constantly pumping these stress hormones out, and we're constantly pumping out sugar. So that can be one of the reasons why, even though you're having a great diet, your blood sugar readings are off. Now, another thing that can influence our blood sugar balance that is unrelated to dietary factors is our sleep. Now, if you remember from the beginning of this episode, I spoke about how when we have blood sugar in our system, our body produces insulin to then help that sugar get into the cell to be used for energy and get it out of the bloodstream, basically. So we want our cells to be really insulin sensitive, to do that really quickly. Now, what research shows is that even just one night of a bad sleep, either not enough or a bad quality sleep, it makes our cells less insulin sensitive the next day. It makes them more insulin resistant the next day. So even if you're eating the same type of meal, our cells will respond differently, and there will be a longer blood sugar spike, and it will be, you'll have more cravings, and it'll be really difficult for you to make the right food choices the next day. And lastly, exercise is also on in a similar thing. If we're exercising regularly and our muscles are healthy and strong, then they make us more insulin sensitive. So that means that when we eat something, even if it has sugars in it, our body can metabolize it much quicker, and we have less of a spike and a less long of a spike. And both of them are important for long-term health. So those are certain factors that you can do in your diet and in your lifestyle to balance out your blood sugar. Now, if you do like the occasional treat, as I said before, try and add some fiber and protein with it, and don't just have it on its own. Get some good sleep, reduce your stress, get some exercise, but also you might want to consider a few supplements. There are a few things that can help your blood sugar balance, especially if that's been a thing that's been going on for a long time and your cells are already a little bit more insulin resistant. Now, number one is something called berberine. And you might know or have heard of the drug called metformin, which is the main diabetes drug. It helps our cells become more insulin sensitive. Now, berberine is the natural form of it. And it's basically a herb, and it has similar effects without the downside effects. What it does, what both of them do, it helps our cells be more insulin sensitive, so balancing out our blood sugar, but it also helps our gut bacteria. It helps increase the good type, the lactobacillus, and it helps to get rid of the bad type. So overall, it has not just one effect on the blood sugar, but it helps with everything that then has knock-on effects on everything else again, like that big cycle that goes hand in hand. Another good supplement to add once in a while is called sodium butyrate, and that is usually if we have a healthy gut bacteria, a gut microbiome, then they produce short-chain fatty acids, including one of them is called butyrate, as a response to eating fiber food. Now, if we don't have enough of the good bacteria in there yet, or if they're just a little sluggish, or we're not getting enough fiber, then sometimes adding in a little bit of that butyrate, that type of short chain fatty acid, can just help our gut to be more healthy, because what it does, that butyrate, it helps our gut lining become stronger, and we have less likelihood of food intolerances and allergies, but it also helps to balance the good and bad bacteria. So again, it's all a feed forward and a feed backward mechanism, circles that go hand in hand, and we want to attack it from all angles to optimize health in the long run. And then a few other herbs and vitamin supplements that can help improve our blood sugar, but also if we have blood sugar spikes, help to kind of reduce the bad effects of them. So number one is cinnamon. It helps to actually balance our blood sugar. Great. Turmeric, a lot of you have heard of it. It's that yellow powder, and that has been shown to reduce blood sugar and especially fructose induced blood damage on our cells. So if you've had a little bit too much sugar, then having a little bit of turmeric can help to lower the bad effects of it. Not take away entirely, but lower it a bit. Same goes for some antioxidants, because you might remember from previously or before in the episode I spoke about when we're having blood sugar spikes, it downregulates our genetic expression of antioxidants. So we have less of an antioxidant capacity in the body to get rid of free radical damage. Now, if we add some of these antioxidants, such as vitamin C, NAC, alpha lipoic acid, research shows that they can kind of mitigate some of that damage, that free radical damage on our system that we have been exposed to because of our high blood sugar or our high sugar diet. Lastly, chromium is a nutrient that helps the body to stabilize our blood sugar. So you can also just if you eat a whole balanced diet, usually you get enough of it, but you can also supplement it from time to time. Now, I hope I haven't scared you away from a healthy lifestyle, but I just want you to be able to make educated choices, because I see it quite often, especially in my friend group as well. People are still lean and healthy and fit, and they have just, they don't realize that there is damage if they're constantly having that little bit of chocolate bar. Even though they're skinny, eventually that might start to wear down their system. So obviously they're getting away with it better because they're exercising, they're kind of reducing that spike a little bit. But long term, they might want to, I suggest that you just try and shift towards an 80-20 rule, where 80% of the time, 5-6 days a week, you really try and nourish yourself, try and have a really balanced, nutritious diet that doesn't cause any damage on your cells. And then eventually, occasionally, you can just have these little treats, cheats, 1 day a week. Your body is likely able to get away with it if it's just an occasional treat. Now, comment below if you found this helpful, and let me know if you have any questions or other topics that you would like for me to dive into, as I'm creating new episodes, and I'll try and be more regular on them. I look forward to seeing you soon.